Today we're going to explore the facial transformation of Kylie Jenner from her teenage years to the present. She has 400 million followers, and therefore she is a huge brand internationally. And the question is, has she undergone any procedures? Has she undergone any cosmetic, surgical, or non-surgical procedures? So let's first focus on her lips, because this is an interesting area. Now, if we go back to her childhood and her teenage years, you can see that her lips are thin, both the upper and lower lips are thin, and all of a sudden, at the age of 17, she can't consent for herself at this age. Her mother, Kris Jenner, has to consent for her. She allows her daughter to undergo a lip filler at this point. And what we can see is clearly that the lips are overfilled. She now has a ratio of 1-to-1, I call it, in terms of the amount of volume on the lips. And normally in a Caucasian patient, it's usually 1 to 1.5 compared to the lower lip. And I think she looks much older than a 17-year-old girl or woman should look at this age. Okay, yeah, I can't say anybody should look a certain way necessarily, but I think she looks older. One of my great fears about Kylie Jenner's decision to fill her lips at this age is that she represents an icon to 400 million of her followers, which are primarily young people. And those young people who idolize her will try to do exactly what she's done. And there are many videos out there to show that they try to enlarge their lips by just following along with what she's doing. To emulate her and simulate what she's doing, they're actually causing themselves harm, and not only physically but also psychologically. And so that's my great fear about her as an icon to so many of these people. These lip fillers not only could have psychological impacts on the person, but they can also cause physical damage over many decades. So if you have repetitive large volume injections of your lips, not only can the filler drift and migrate, but it can also cause some scarring internally in the lip and change the contour of the lip. So as the lip deflates, say you want to go back to your original shape of your lips, the lip may now be kind of a floppy and not retain its normal tone. So I would suggest that this is actually physically detrimental as well. It's not only psychologically detrimental. And in particular, if it started at a young age and now people are wed to the idea that they have to continue to keep the look that they changed into and constantly chase the volume that they need to maintain that, it changes the contours of the lip and the anatomy of the lip. So again, this can have huge impacts on her fans who are emulating exactly what she does. Let's now refocus on her nose. And as a child, we can see that she has a broad nasal bridge and a bulbous nasal tip. And if we fast forward a couple of years, we can see that the nasal tip is now much more refined, and it's possible that she had the lower lateral cartilage trimmed, which allows the eversion of the nasal tip a little bit and narrowing of the tip, as well as the bridge of her nose, which may have been narrowed by performing what's called osteotomies, which are incisions through the bone, which allow the nose to kind of collapse inward. I think her results are fantastic, and in contrast to her lips, I think it's age appropriate in terms of her the subtle change that she's undergone with a rhinoplasty. Now, if we look at her eyes, we can see as a teenager from the baseline where she hasn't had any surgery, she has very low creases, and her brow is almost touching her eyelid crease. And as she ages, this changes markedly, and you can start to see there's a lot more platform of the upper eyelid, and there's a kind of a split between, like I call it, a 2/3, 1/3 split on the upper lid, and that implies that she might have had an upper lid blepharoplasty, although I'm not entirely sure, but we can see a dramatic difference between her eyelids as a young woman compared to her teenage years. Now, in regard to her brows, it looks like she has changed the contour of her brow. I don't know if that's just a cosmetic change where they've contoured the brow, or actually whether or not she's had any thread lifts, which is this barbed suture that's woven under the skin and to raise the corner of the brow. upward, or whether she's had any other procedures to change the contour of the brow. She might have also had Botox, because Botox, if it's injected around the forehead in certain strategic places like the center of the brow and the lateral tail of the brow, sometimes the brow will rise just from Botox injections, and it looks like she has no lines or wrinkles anywhere, even though she's in her 20s, of course. But it's possible that some of that elevation of the brow is due to Botox alone, not from any surgical interventions. Now, let's talk about facial fillers other than the lips, which we've already covered. Now, you can see clearly, even at the age of 19, she's filled in the nasolabial lines. She virtually has no lines at all on her face. I don't know if this has been photoshopped, the picture, but it looks like she's filling in areas where she should normally have lines. And this can be a big issue as we start to age forward, and I don't mean very far forward because she's only 27 at this point. You can see that these facial fillers have had a negative impact on her face. You can see the malar bags on the lower lid and that swelling, and everybody was talking about it on the internet. And yes, this is the consequence of overfilling parts of her face. And she looks much older than she should at this age. She's starting to look middle-aged, actually. That is of great concern. And you can see there are consequences of overfilling the face. And you have to be very cautious. And my philosophy is less is more. Go slow. Don't overdo it. Yes, fillers can be a benefit to people. I'm not in the camp of believing that fillers should never be used. I do think they have some value in certain people, but I don't think that you can go push the envelope too far and end up with a problem that you're constantly chasing and trying to correct. Reviewing Kylie Jenner's evolution from her teenage years to the present, we can learn a lot. I think we can see that maybe early interventions, cosmetic interventions, are not necessarily to your benefit. You can't chase every single line on your face or every little bump. I think that you have to be comfortable in your skin, and I think that we're going to see in the future significant complications from people who start surgical interventions too early. And we haven't really gotten there yet. It's going to grow because of the internet and the popularity of these icons. I think we're going to see more and more people have issues. So if you have any questions, please leave them below. If you enjoyed this analysis of this celebrity, I'm going to do more celebrities in the near future, and I look forward to seeing you again.